In Epidemiology Part 2, we will be describing how the virus is spread throughout the world and how the U.S. has failed to control the spread of COVID-19. The outbreak began as a point source in Hunan live animal fish market, and the majority of cases were among market workers depicted in yellow. However, within 10 days, the disease rapidly spread person to person to those who had not been in the market, the blue bars, demonstrated early on that this virus was highly infectious. There's some debate with regards to when the outbreak began in China. Some suggest a larger number of asymptomatic carriers were spreading the disease before the publicized December outbreak. These maps document the rapid spread throughout China. Each 10-day interval documents spread outward from the city of Wuhan, where the market was located, into the entire Hubei province and progressively into the other eastern provinces. The infection quickly spread throughout the world as a consequence of Chinese citizens traveling to Europe, particularly to northern Italy, and tourists infected while visiting Italy then spread the virus to New York City. Chinese also traveled to Seattle, explaining the first outbreak in the U.S., as shown on this map from the Center of System Science and Engineering from Johns Hopkins. As of January 13, 2021, there have been over 91 million cases and nearly 2 million deaths, for a death rate of 2.1%. The U.S. continues to lead the world with 25% of all cases, with nearly 23 million cases. Remember, we represent 4% of the world's population. This was followed by India with 10.4 million cases and Brazil with 8.1 million cases. Why is the U.S. leading the world in cases? The simple answer: failure to act. To illustrate the importance of early intervention, I commissioned the famous artist and family friend Bruno Lucchesi to draw an image of Pandora's jar. Zeus, angered by the deceptions of Prometheus, warned that a great plague to you and yourself and to men shall be. He created Pandora, a beautiful maiden, and fashioned a jar, often mistranslated as a box, containing all the pestilence of the world. He encouraged the curious Pandora to open the jar, releasing a plague on all men. 3,000 years later, we are now experiencing such a plague in the form of COVID-19. And when politicians delay applying the tools of infection control, they are leaving Pandora's jar open, allowing the virus to spread, causing unnecessary suffering and death. These are the epidemic curves earlier in the pandemic for South Korea, China, all the European countries, including Italy and Spain, the Scandinavian countries, Australia, and the United States. The vertical axis is a log scale of the number of deaths per day from COVID-19. Each star represents the time at which the government implemented shelter in place, that is, when they closed Pandora's jar. Look at South Korea. They implemented shelter in place and aggressive diagnosis, case finding, and isolation after observing 3 deaths per day. Note the nearly flat curve for South Korea, pale blue. Also notice the number of cases has dramatically dropped in China, the orange curve. They intervened after 3 to 4 deaths per day and after a total of 30 deaths. Italy, black curve, on the other hand, waited until the daily death rate was 75, and they had accumulated a total of 800 deaths before ordering shelter in place. Note the steep curve as a consequence of leaving the jar open. Italy has had the highest number of deaths of any European country at that time. Finally, note the steep curve for the U.S., red. The U.S. did not implement a uniform policy. Some states sheltered in place, others choosing not to intervene. The consequence of this approach? We have by far the largest number of active cases and deaths in the world. To make matters worse, we reopened states who chose shelter in place in early May, and many have ignored recommendations to wear masks. Here are the current epidemiologic curves for some of the same countries. The vertical axis is the number of daily cases in thousands, a 7-day average, and the horizontal axis days. Note the steep rise in cases during November and December in the U.S., arrow 1. Too many people ignored CDC recommendations to stay home for the holidays and traveled to visit family. The U.S. is breaking records daily for new cases, recently averaging 270,000 cases in one day and 3,000 to 4,000 deaths per day. This contrasts to Germany, Arrow 2, which is aggressively tested and contact traced and has experienced only a modest rise. Note the flat curves for India, China, and Japan, whose populations have followed infection control recommendations. Also note the rise in the United Kingdom, Arrow 3. If we control for differences in population by plotting new cases per million, you see that the UK has experienced an abrupt rise in cases beginning in early December and now is experiencing rates of new cases comparable to the US. The reopening of pubs may partly be responsible. However, authorities are blaming the rapid spread on the new mutant virus. Here is the United States map for January 13th, 2021, from the Centers of Systems Science and Engineering at Johns Hopkins. As noted in October, the entire nation remains covered in red, and cases have been steadily rising in nearly all states. As of January 13th, we have nearly 23 million cases and over 380,000 deaths. Los Angeles now has the largest number of cases, closing in on 1 million cases, followed by New York City and Chicago, both with over 400,000 cases. Phoenix and Miami are fourth and fifth, each with over 300,000 cases. This map, generated by the Harvard Global Health Institute, shows the prevalence of disease by location. Red zones represent areas with over 25 cases per 100,000, orange 10 to 24 per 100,000, yellow 1 to 9 per 100,000, and green less than 1 per 100,000. In October, the highest prevalence was seen in the Midwest. Now you can see levels of 75 per 100,000 and higher are present throughout the U.S., indicating the epidemic is out of control everywhere. California, Arizona, and Texas have many areas with levels of 130 to 150 new cases per 100,000. Now let's briefly contrast the U.S. response to that of India. Early in the pandemic, India instituted aggressive shelter-in-place measures, but this approach resulted in severe loss of income as well as starvation, forcing reopening of the country. Shelter-in-place provided time to establish testing centers and COVID-19 hospitals, as well as educate the population on the importance of wearing masks. However, crowding in the cities initially led to the explosive growth of cases, and India became the second in the world when it comes to total cases, at 10,512,093 as of January 14th. And they are third when it comes to death at 151,727. The Mumbai area has the most cases, over 1.9 million, followed by Andhra Pradesh, Tamil Nadu, and Kerala, all with over 800,000, and New Delhi with 600,000. But remember, India has 4 times the population of the United States, partially explaining their high numbers. As shown on this epidemic curve, India has dramatically reduced the number of cases, and as of January 14th, the number of cases per day had dropped to 1.2 per 100,000. India's investment to create a public health network had clearly paid off. Contrast this curve to the US. Our cases continue to steeply climb, and new daily cases are averaging 75 per 100,000. To summarize the content of this video, the epidemic began as a point source outbreak in a live animal fish market in Hunan, China. As of January 13th, worldwide, there were over 90 million cases and over 1.9 million deaths. Many countries experienced exponential epidemic curves as a result of delays in implementing infection control practices. They left Pandora's jar open. Testing, case finding, and isolation are critical for controlling the spread, and many countries have now managed to control the epidemic. The United States has failed to consistently implement appropriate infection control measures, resulting in steep increases in every state. The U.S., with 4% of the population, has 25% of the world's active cases and 20% of all deaths due to COVID-19. India now has the second largest number of cases, but as a consequence of effective public health interventions, presently has their epidemic under control.